everybody. In this video we will speak about the part 2 of the follow-up. And we have already spoken in previous video about the tasks of the therapist during the follow-up. The first and the most important is to boost patients' hope, self-confidence and confidence in the therapy. If you do not succeed, so the success in the therapy will be improbable. And you should also appreciate investment of the patient into the change, reframe his motivation, boost his courage, and reframe results. Your task is also to adjust the remedy combination, although it is not as important as one might think. And you also sometimes, if everything fails and it seems that there is no change, your task may be to gain at least some time to wait whether there will be at least some reaction in the patient. And we have following tools, following communication techniques we can use during the follow-up. The most important is to concentrate on positives. And we can use reflections. We have spoken about reflections in the last video. We can use affirmations, open questions, summaries, comparing extremes, using quantification or scales, and reframing. For the video about communication techniques, please click on the link below the video. And it's very important to concentrate on positives. There is a big difference between the first consultation, where you need to collect as much information as possible, and you spend time with speaking about guilt feelings and panic and so on. And during the follow-up, you concentrate on the positives, on the changes that have happened since the last consultation. And you would like to develop them, to boost them, to promote them, so that the patient's courage will grow and he will continue in them. And affirmations are very important during the follow-up, especially because they boost patient's self-confidence, and they help him to recognize that he has some resources he can use, and that he is going the right way in the change. And especially when the affirmations are in, or the change is in accord with the action of the remedies the patient uses, you can, using affirmations, invite him to continue in these changes, so they will be faster. For example, imagine a Centauri woman, until very submissive, and now she reports, and my husband is still very critical to me. Yesterday, when he criticized my cooking skills, I got angry and refused to cook the dinner. This behavior certainly doesn't correspond to the negative part of Centauri. It's more the positive sign. And you should use affirmation for that. It was too much for you and you were able to set boundaries to say no. So there is a higher probability that next time she will repeat this behavior. Or, for example, a patient that is panicky because when she has to do some presentation and you maybe prescribe him Mimulus and Rockrose, and the patient comes and he tells, my self-confidence is still very low. I finally agreed to do this presentation, but the fear was terrible and my fingers trembled. And of course, there is a positive part and negative, and it's necessary to use affirmations for the positive part, and do not pay much attention to the negative. Of course, hands trembled and so on, but the most important thing is that the patient went and did the presentation, so he didn't postpone it, for example. In spite of your fear, you did the presentation. You do not give up. You are a fighter. So you attribute it to the patient an interesting characteristic. He is a fighter. You can also use open questions to develop the positive theme in the change. And my husband is still very critical to me. Yesterday, when he criticized my cooking skills, I got angry and refused to cook the dinner. So we continue with the Centauri patients. patient. And you can react with an open question. How did you feel when you told him no? So she maybe will describe that she felt quite well, and she felt that her reaction was justified. And it's very important to confirm that her behavior was the right one for that moment. Or as for this person that gets panicky when he has to do a presentation, you can react, and what helped you to overcome the fear? So you can develop the theme of the resources that help him to succeed. You can also use summaries. In summaries, you make an extract from the whole consultation, and you take bits from negative and bits of positive. It's usually better to take both parts, positives and negatives, but you always start with the negative and then you continue with positives, like with two-sided reflections. So you feel you have slightly more energy, so positive. Your reproaches of conscience are still there, so negative, and they are less intense, so you end with positive. You aren't able to express your opinions clearly yet, so it's negative, and your inner dissatisfaction is growing, so there is some positive change. You feel you have less fear of consequences if you tell something your husband will not like, so we end with the positive. And do not forget to ask what else, or have I forgotten anything. Sometimes the problem of the patient is fluctuating, for example, like headaches. And there are moments when he feels fine, and there are some moments when he feels badly. And this fluctuation is the reason why it is quite difficult sometimes to assess the course of the therapy. Because the patient naturally concentrates on these negative parts when he had this headache, but neglects the moments when he feels well. And to help him to concentrate more on the positive part, you can use the following comparison. When you remember the best time during the therapy and compare it with the best time before the therapy, what would you tell? So when you compare these extremes, maybe at present the positive moments were better. Or you can also compare the negative moments. When you remember the worst time before the therapy and the worst time during the therapy, what would you tell? Again, maybe he would tell that migraine still was there, but it was not so intense. The amount of pills that he needed to take was less or lower, so the intensity of this migraine was lower. You can also use quantification or scales to measure, to objectivize somehow the degree of the complaint. For example, migraine, again. You can ask how frequently have you had migraines before the therapy and now, or how long does it last now, or how long did it last before the therapy, how many pills have you to take. Or you can use a scale, for example, 0 is a terrible moment and 10 is absolutely without complaints, and you can speak about these numbers. For example, the patient tells that his self-confidence is still very low, and you can ask him to measure his self-confidence on the scale. 0, it means absolutely no confidence. 10 is maximal possible self-confidence. Where are you now? And the patient may say, for example, he is on number 2. And you can continue with developing the positive theme. And why is your self-confidence 2 and not 0? So maybe he will speak about what gives him at least some self-confidence. Or you can ask him about what would help him to move from 2 to 3. So you should offer him a small step only, not from 2 to 10, it is impossible, but from 2 to 3, it's possible that maybe if some change happens it can help him to boost his self-confidence. So you can again develop some positive theme. So reframing is a technique that helps to change the interpretation of some fact, and this fact is often disagreeable. For example, when we speak about some problem, or the patient speaks about some problem has quite negative connotations. It often means some failure, some maybe even disease. The patient is unable to deal with this problem himself, so he is somewhat inferior to the other people. However, if we reframe this problem to a challenge, it's quite different, because challenge is something positive. It is an opportunity to grow, to develop spiritually, for example. So only this change can boost the patient's self-confidence and his effort to make the change, to fight with this challenge. And for example, if the patient describes big difficulties he has to deal with, you can reframe it that he is a fighter. He fights with big obstacles. Being a fighter is something people can be proud of. Or the patient describes his failures at the exams, and you can reframe it that he has collected a new experience and he can learn from it, and next time he will have a higher chance that he will succeed. So, still once, as for the communication techniques, we have spoken about reflections in the last video, and there are also affirmations that are very necessary, and they support the patient to develop the positive behavior. Open questions, summaries, we can compare extremes, and we can also use quantification or scales to measure, for example, migraine or self-confidence. And we can also use reframing. So, thank you very much for watching this video. I hope you have enjoyed it. And in the next video we will continue with another case, and now we will speak about the follow-up of this case.